going, Timmy?
Yeah, check out tomorrow.
I better not see a grain of sand in my car, eh?
Terrence, hurry up. Let's go.
It's a bunch of haters, man. Because I just switch and I need to talk to you. You see you later, right?
Put on all your seatbelts. Let's go. Hold up to me. Terrence, what are you doing? Buckle up.
Man, I'm in the back seat. I'm getting right around the corner to the house.
Nah, boss. People will be speeding on this stretch all the time. If you really want to live to see Crystal later, you got to buckle up.
Ridiculous. Let's go, Timmy. I gotta go home and get fresh anyways.
Me know what Crystal saying you anyway, dog.
Seatbelts save lives. Buckle up. It's your life. It's our law. This message is brought to you by the Virgin Islands Office of Highway Safety.
Good day, and welcome to the Government House Weekly Press Briefing and COVID-19 update for the week of April 25th, 2022. For the benefit of the radio listening audience, I am Government House Communications Director Richard Mota. Joining me this afternoon on behalf of Health Commissioner Justa Encarnacion is Dr. Esther Ellis for the latest COVID-19 data and information on where Virgin Islands residents can get a COVID-19 test, vaccine, and booster shot this week. But before I go to Dr. Ellis, I am pleased to announce this afternoon that Governor Bryan has just been cleared from quarantine by the Department of Health. The governor tested positive last week upon return from Washington, D.C. and Miami, where he was invited to keynote the National Conference for Workforce Development in the nation's capital and for a status meeting in Miami with the Northern Maritime Institute on the USVI's Ship Registry Initiative. The governor, who is fully vaccinated and boosted, did not experience any symptoms and was thankfully in good health and spirit while quarantined. Governor Bryan wants to thank everyone for the calls and warm-hearted get-well messages he received over the last week. Governor Bryan, it is good to have you back in person, and I hope you got some well-deserved and much-deserved rest. While on the topic of vaccines and boosters, as an added means of ensuring Virgin Islanders are as protected as possible ahead of the carnival activities this coming week and into the weekend, the Department of Health has launched a $250 vaccine incentive program for individuals who get fully vaccinated during the month of April. The DOH announced this last week, but I want to remind the public on some of the details on exactly who qualifies. In order to qualify, you must receive your full vaccine series during the month of April. And if you've already received your 2 shots of Pfizer or Moderna or your 1 shot of Janssen, you will qualify if you get your 3rd or 4th booster shot also during the month of April. And that 4th booster shot, of course, is based on specific individuals who qualify for that. Eligible individuals will receive their card once they get their shot at the vaccine centers at Charles Hallwood Clinic in St. Croix and the Community Health Center located in the Royal Leicester Schneider Hospital in St. Thomas. Dr. Ellis?
Good day. Thank you, Director Mota, for the opportunity to provide COVID updates this afternoon. As St. Thomas embarks on its highly popular carnival events, I caution all attendees to be extremely vigilant with respect to the COVID-19 protocols and to take every measure to protect yourselves. As was shared in a press release late last week, the Centers for Disease Control and Prevention, or CDC, indicates that the Omicron BA.2 variant, which is here in the territory, spreads more quickly than earlier variants, including Delta. Anyone with an Omicron infection, regardless of vaccination status or whether or not they are experiencing symptoms, can spread the virus to others. For the last week, the VI data shows our cases steadily rising. We currently have 248 active cases in the territory. 140 are on St. Croix, 107 on St. Thomas, and 1 is on St. John. Our positivity rate is 6.0%. In regards to vaccinations, we have provided 68,933 first doses of the vaccine and 56,648 second doses. There are currently 4 individuals hospitalized on St. Croix at the Juan F. Louis Hospital and 4 individuals on St. Thomas at the Schneider Regional Medical Center. None of these 8 individuals are vented. Many of you who routinely attend carnival events know that many of the events, despite being held outdoors, are conducted in spaces that are compacted, causing people to form tight-knit groups. When you attend these functions, you will be in crowds where social distancing will be extremely difficult to achieve. We want everyone to be safe and stay healthy. Please remember, if you get exposed to COVID-19, you can unknowingly bring the virus home to loved ones who may be elderly, immunosuppressed, or too young to be protected by the vaccine. Please practice the COVID-19 protocols everywhere you can. Wear your mask, hand wash frequently, and remember to socially distance wherever possible. Also get your vaccine if you haven't already. During the Carnival Village events on St. Thomas, the Department of Health will have both a Department of Health van and a tent providing COVID-19 vaccines and testing, as well as STD and HIV testing, each evening from 7 p.m. to 10 p.m. The van will be parked alongside EMS and Vitima booths. The department will also be present for the food fair on April 27th from 9 a.m. to 4 p.m. The VI Department of Health wants to remind everyone that individuals who become fully vaccinated or receive a booster between now and April 30th, whether at the clinic or in the village or food fair, will receive the $250 incentive card. Let's talk about some temporary schedule changes. Administrative leave for the carnival events on St. Thomas has been granted to all non-essential government workers on St. Thomas, Water Island, and St. John districts. For this reason, for this week only, there are a few changes to the vaccination and testing schedules. The Community Vaccination Center at the Community Health Clinics adjacent to the Schneider Regional Medical Center will be open from 8 a.m. to 5 p.m. on Monday and Tuesday as usual. Wednesday, the CVC will close early. It's open from 8 a.m. and closes that day at 1 p.m. The CVC will be closed all day on both Thursday and Friday. CVC services will resume on Monday, May 2nd. As a reminder, the Community Vaccination Center on St. Croix will remain open for you to get your first dose or your boosters. Appointments are encouraged in St. Croix due to the new smaller location at the Charles Harwood Memorial Complex. Call 340-777-8227 or visit covid19usvi.com/vaccines to schedule an appointment. Of course, walk-ins are still available. If you test positive with a home test kit, please immediately isolate and obtain a confirmation test at a lab or provider or the DOH testing drive-through to become eligible for COVID-19 therapeutics. These are the oral antivirals or the monoclonal antibodies. You are eligible for these life-saving treatments regardless of vaccination status. The VI Youth 250 gift cards can still be picked up if your child received both vaccines in either of the gift card giveaway promotion periods. Cards can be picked up at the CVC on St. Thomas, Charles Harwood on St. Croix, or at the Morris DeCastro Clinic on St. John between the hours of 9 a.m. and 4 p.m. For the latest COVID-19 information, visit U.S. Virgin Islands Department of Health Facebook page or the website www.covid19usvi.com. And for COVID-19 health information alerts, text COVID-19 USVI to 888-777. The Department of Health is also working on a territory-wide COVID-19 survey about your experience during the pandemic. I would like to ask for the public's support for this important survey. The VIDOH will be assessing the social, emotional, and financial impact that the pandemic has had on Virgin Island residents. You can complete the survey either online or in person at Costuless and Plaza Extra on St. Thomas and St. Croix, or the Starfish Market on St. John. The 24-question survey is anonymous, quick, easy, and your participation will help the Department of Health determine how COVID-19 has impacted our community. The QR code is accessible on the Department of Health webpage, that is doh.vi.gov, or the Facebook page, also by scanning the QR code that you can see right now on your screen. Please scan this code and take the survey today. Thank you for the time to share this information. Director Mota, back to you.
Thank you, Dr. Ellis. As we announced last week, government offices will be closed and non-essential government workers granted administrative leave this Wednesday, Thursday, and Friday in observance of the carnival activities. Governor Bryan has granted administrative leave for non-essential government employees in the St. Thomas, St. John district from 1 to 5 p.m. on Wednesday, and on Thursday from 8 a.m. to 5 p.m. I'll repeat that again. The governor has announced administrative leave for non-essential government employees in the St. Thomas, St. John district from 1 to 5 p.m. on Wednesday, and on Thursday from 8 a.m. to 5 p.m. Non-essential government employees territory-wide have been granted administrative leave from 8 to 5 p.m. this coming Friday. So Wednesday from 1 to 5 for those non-essential government employees in the St. Thomas, St. John district. Thursday from 8 a.m. to 5 p.m. also for those non-essential government employees in the St. Thomas, St. John district, and from 8 a.m. to 5 p.m. for all non-essential government employees territory-wide on Friday. Governor Bryan wants to encourage carnival revelers and all in the community to be safe this weekend and to follow the Department of Health and Health guidelines and also your better judgment as well. The administration has thought long and hard over the protocols it has in place, and those protocols have protected us as a community. So please follow the guidance in place. It will go a long way in protecting you and your loved ones and our greater Virgin Islands community, as we've seen in the past. In closing this afternoon, Governor Bryan has issued a statement on the 34th legislature not advancing a specific measure last week with the potential to disrupt critical federal recovery funding to the territory by allowing certain major contractors who receive FEMA funds to seek reimbursement of gross receipt tax payments from the federal government. The governor noted that the bill was ill-conceived and caters to special interests. The Virgin Islands government, and in particular this administration, has built strong relationships with FEMA and our other federal partners in the recovery and has worked to build the trust of those federal agencies. This measure jeopardizes our working relationship with FEMA and HUD, the governor noted. At this time, we will take any questions from the media, and I see that we have at least one member of the media joining us virtually. Suzanne Ellis from the Virgin Islands Source. Go ahead, Suzanne.
Hi, good afternoon, Richard and Dr. Ellis.
Good afternoon.
Just a couple of questions. So there will be no mask mandate reinstated for Carnival, correct?
Yes, that is correct.
Yes. Okay, great. And the positive cases, are they vaccinated individuals or unvaccinated?
Vaccinated individuals, or the positive individuals, are they vaccinated or non-vaccinated?
Oh, so the positives that we're reporting, the 248 active cases are a mixture of vaccinated and unvaccinated. As we've said before, you can still get COVID and be vaccinated. You just you're not going to get as sick. You're way less likely to get hospitalized. Out of the 8 individuals that are hospitalized, I would have to look that up, and I could get back to you regarding if any of those are vaccinated.
That would be great. Thank you.
Thank you.
That's all I have.
Okay, thank you for that, Suzanne. I don't see anyone else joining us virtually this afternoon, so I take it that that is all the questions that we have from the media. With that, I want to wish everyone a happy and safe Carnival week. Remember to wear your mask where required and get the vaccine and booster now that they are available, and you can get $250 for it. So go out and get your vaccine and your booster shot. It'll help to protect us all, to protect you and your loved ones. With that, have a good afternoon, and we will see you all next Monday.